Dear friends, today I will share with you experience how we standardize biohacking for other people. Here in previous very brilliant reports, we heard a lot about separate parts. How can we measure lab tests or calcification? How can we influence health? For example, extreme temperature. We heard particular cases as previous report, but now I will share you our experience how we do standardized biohacking for other people, and we already made a lot of such cases, and I will share with you this information. Also, I would like to propose official determination what is biohacking, because here today we all physically biohackers in one place, but still in our heads there is no similar answer on the question what is biohacking. And I believe that after this determination will appear, biohacking waits another breakthrough. So first of all, I would like to introduce myself. My name is Sviatoslav Khanenko. I'm a medical doctor, family medicine and public health expert, and I am also Master of Business Administration, because once my challenge was how to make product, how to make preventive medicine to be sold. And that's why it becomes not so much medical solution as a business solution. But after I made circle being businessman, I came back 2 years ago to medical practice, and now I'm practicing again. But it's more like health management. It's medical stuff, but it's management as well. So this is me and my wife. We are best friends, partners, and we do all our businesses together. And I wanted also to a bit make emphasis that relationship, quality of relationship is very important part of health. This is my my photo. I always wanted to be a doctor. I never felt or never thought about other destiny. And I always wanted to be preventive doctor. I never wanted to be disease doctor. This is our clinic, first biohacking clinic in Ukraine. I don't know, maybe in Europe. If you know other clinic of biohacking, please tell me. I would be glad to share experience. But this how we work. As you see, we make design especially not to be look like hospital for disease. We work only with young doctors because there are no biohacking doctors ready. We train them. That's why it's easier and more productive to work with younger doctors. They are more flexible. They're more creative, and we use as a typical medical procedure in diagnostic and in health improvement programs as more innovative. And mission of our company, why we do biohacking. For me, it's very personal, because when I was 16 years old, I realized my mission. My mission is to overcome demographic crisis in Ukraine. Maybe you know that since 1991, population of Ukraine decreases almost twice. So it's existential question for us, to be or not to be Ukrainian people. And another target, not mission, but target, is to implement biohacking into primary healthcare as basis. For the moment, in Ukraine, we have highest mortality and morbidity rate in Europe. And we don't have primary health care. 95% of doctors in Ukraine are neuro specialists, which are specialists in diseases. And people get into healthcare system being already very deeply sick. And result we have almost twice decreased population. And with such trends, in 20 years we will disappear. And biohacking in these conditions, when we have empty primary healthcare, may become basis management of health, proactive management of health, instead of focusing on diseases. And there will be much less sick people in such case. What is the target of this particular presentation? I would like to solve two important things. First, I would like to share to you our practical experience. We are practics. Each day, from early morning to late evening, we work with health indicators of people. It's our work. We are professionals. And the second one, I would like to suggest you official determination. Please, in the next slide it will be, please make a photo. After I will share with you experience. Please think over. Maybe you would like to add something or you would like to remove something. And I would suggest to agree this one particular determination. What is biohacking? For us all to be in the same page in our heads. What is biohacking? So, this is the sign which developed by Teemu, and it almost the same what we have been doing. And when I came last May to Stockholm Summit, I was so inspired that what we have been doing since 2016 in absolutely different place, in different people, we got the same ideas. The matching was 80%. Separate people, different places, but the same idea. And here we crossed. And now I will show you how even in details this scheme, how we work almost in the same way as Teemu has been telling. So this is a determination of biohacking, which I recommend to approve. Biohacking is a measurable management of health indicators in order to reach optimal recovery, peak performance not only in business, also in relationship, in health. We also need to put goals for our health and to reach them. Reaching the goals, we need to have goals. These goals has to be balanced, and it's also part of health. And as a result, self-realization of deep mission everybody has based on values. So please, in the end, I will ask you to vote or propose something to this determination. What is health? If we say health management, what is health? According to World Health Organization, since 1948, it's a state of complete physical, mental and social well-being, and not merely the absence of disease or infirmity. It would be perfect determination. Only one word is a problem: complete. What means complete? Has everybody seen complete well-being? They try to make health absolute category is a problem. If we change this one word from complete to measurable, it becomes perfect, because we can measure well-being and we can measure each particular indicator of health. What is management? Management is more technical stuff. It's the process of analysis, planning, motivation, and control of some indicators, and in order to reach target goals. So this is the scheme of Biohacker Summit. This is our scheme. When Biohacker Summit says, or Teemu says, decoding health, we technically provide diagnostic, which consists of 9 modules and starts from 2,000 parameters. I will tell you more detailed what are they. When it goes self-quantification understanding, we develop personal health improvement program based on each particular case of health. I will tell you more detail what it also consists of. After optimizing health, start process of performance and feedback and updating the program, because this personal health improvement program is very like organism. For example, we prescribe some recommendation, person even agree it, but in the process of maintenance of this program, some changes also happens. Because, for example, person think that some changes are acceptable, and when person start to implement them, and it starts not to get done. So it's very lot of work in order to reach results. And after we hear client, what he or she want to do, we provide continuous changing, we can reach results, transforming health, first results. And these results, they has to be, how to say, proved by dynamic checkup. So we don't do such big diagnostic 2000 parameter, but we can check parameters that we wanted to change. And very important phase, learning. We also have to learn all the time after each particular cases. What we prescribed, what worked, what didn't work. There are tons of information which will help, each case can help other people. So now I will tell in more details what exactly we do. So diagnostic, 9 blocks, goals, very important. Goals are already existing objects of yourself in the future. Goals has to be, they or exist or not exist. They or true or false, because for example, somebody thinks they want something, but they are not. These goals are not based on the true values. And goals may be balanced and may be not balanced. For example, if person has true goals only in business and don't have goals according to health and according to relationship, there will be problem. They will reach good results in business, but their fundamental things will suffer, health and relationship, and they will not reach these wanted results in business. So goals, very important part of health. Exist, not exist, they has to be goals, they has to be real, and they has to be balanced. Next block of health. What is on the base of our somatic, of our body, our DNA? What we can know from our DNA? We can know our biological age, the only dynamic genetic test, our biological age based on length of telomeres. We can determine disease risk. We can know metabolic specificity. We can know what product, what nutrients appropriate for this particular people or not. Next, antioxidant balance. In one of the previous reports, we talked about a lot about vessels, metabolic syndrome. Really, it's a very big problem. But cholesterol and insulin, especially cholesterol, the primary reason of this problem is defect of inner part of vessels, of arteries, which become result of chronic oxidative stress. Lot of antioxidant, a lot of free radicals, not enough compensation by internal antioxidant system, not enough of external nutrients, antioxidant, and that's why we get high cholesterol, then increasing of blood pressure, then strokes, etc. But antioxidant balance is in the very basis of this situation. Then, functional parameters, body shape, body composition, power, and endurance is absolutely measurable parameters, which can be, from the one hand, motivation. People want to improve their health in order to look better. What is our appearance? It's our shape and quality of our skin. So we can use this parameter as motivation, but also, for example, person in a good shape, but in a bad muscle power can be one of the sign of burning. All parameters of analysis may be okay, but if we see that person do sport, but muscle power is much less than it should be, it may become a conclusion that energy level is low, so some indicator of burning. Then next block is internal organs. 10 systems from up till down, neural system, ophthalmologic system, otolaryngologic, digestive, respiratory, genital, and so on. We have very good data how these systems are interconnected. Big mistake to treat each particular system as separate things. All is very interconnected. For example, in Ukraine, the biggest problem is of mortality is cardiovascular disease. But during our work, we discovered that 95% of our population, even good income, have total very big problems with digestion. And digestion is a primary stage of cardiovascular problem. Because if you have bad digestion, even you eat the best food which is in your plate, but after it gets into your digestive system, it creates into poison and gets as poison with the blood. So I can tell very lot of different cases about how state of each particular system influence into others. So you may have problem with one system, but it manifests in other. And one of the very interesting organs which becomes like a mirror of all health is skin. So we, in our work, skin takes separate big part. And we can calculate parameters of the skin as well. Structure parameters, number of wrinkles, depth of wrinkles, square of wrinkles, and functional parameters on whole body, elasticity, moisture, pH, and so on. And for example, we had in the last week a girl. She's very sportive, in very good shape, but her main problem was acne on face. And we discovered that the main reason of this acne is a problem of dysbiosis. But the thing is that you never solve dysbiosis only by getting probiotics or even by diet. Even she has perfect, even maybe overtraining, but we have to put balance in each part of her life in order to improve her biosis of her digestive system, in order to solve her problem with face, with acne. So another point how everything is interconnected and how we cannot to pay attention to each of these parts. Then, lifestyle. Here everybody knows, but we also can calculate. We can calculate what quality of nutrients, of food people consume. We can calculate regime, how many times they eat. We can calculate what is the composition of what they eat, in what order they eat. For example, very big difference. In our recommendation, we take Mediterranean diet as a basis to improve, because our nutrological behavior in post-Soviet country, it was not how to eat healthy. It was not how to die from hunger. That's why a lot of dishes was like soups, for example. Less products, more volume of food. And in our culture, we don't use to separate for starter, main course, and dessert. But it's so easy, and it's so good for our digestion. And to start not from soup, but start from salad, for what is good for our bacteria. So, and this is like basic recommendation what we start to implement, and it's not so easy. Even though Mediterranean diet is very tasty, but changing habits is very not easy. Water, food, physical activity, mental activity, bad habits, and sleeping, of course, what we can calculate, what we can measure, and then we can influence. And this is 70% of result. Only 30% medical procedures, medication, and so on. Mental health. We divide it into two parts. First, life satisfaction, we can also measure it by a questionnaire, and cognitive function, how we can collect information, remember information, proceed information. It's very important for 21st century when we work mostly by head. And cellular health, a very simple method. We can take a blood drop, put it under microscope and see erythrocytes. And very important, their status of their membrane. Are they separate or they like sticked? Because if erythrocytes are separate, they can get into the narrowest vessels. And if they are sticked, they are not get into capillary, and it goes total hypoxation because cells doesn't get enough energy and becomes a problem. Then the next step, after we calculated, quantified health, we go to the stage of development and agreement of personal health improvement program. And which part of this program? It's lifestyle correction, acute problem solution, because if you have acute problem, for example, risk of cancer, you need to do a bit different action when you don't have this problem. You cannot talk with person about Mediterranean diet if they have analysis, lab tests that probably they have cancer. Then medical procedure, we still can do something by ourselves for patient in order to improve health. And one of the most important things is assistance. When personal doctor who collected this information, proceeded this information, and developed this personal health improvement program becomes like general manager, project manager of health improvement process. Then lifestyle correction, bad habits, nutrition, everything like that. The only thing is motivation. It's very difficult thing to change habits. And we also have to find some, among the goals of person, some bottom which we have to interconnect. How? Drinking more water, more better nutrition, and reducing bad habits will interconnect, will influence reaching these goals. So that's why very important to know goals of people in order to change habits. And habit, it's a cycle which exists in energy, energy low consumption mode. And to change habit, it requires very lot of energy. That's why this process goes so hard. And that's why we need to provide each possible way to add energy, or by changing habits or by external influence. Then, acute problem solution. We can prescribe additional examination. We can prescribe consultation of neuro specialists. We can collect consilium among different specialists in order to solve problem. And we can provide guideline, official guideline. For example, if we see some bad problem diagnosis, we prescribe guideline, official guideline. But very important, if person has a different, for example, 2, 3, or 4 diagnoses, it's very important to make balance between these guidelines, because if we just directly implement them, we can harm person, because some guidelines may be opposite to each other. Then, procedures which we can do directly without decision, we can provide value to health of the person from outside. It's still pharmaceutical substances. It may not be antibiotics or hormones, but amino acids, microelements, or resveratrol or glutathione may be delivered directly into veins, not through, for example, inflamed digestive tract. Physiotherapy, for example, extreme temperature, it's also kind of physiotherapy, influenced not by chemical but by physical way. Manual techniques, osteopathy, kinesiology, craniosacral therapy may help. Spa also may help, especially for skin. Oriental medicine, mechanical action on biologically active zones may also help. Please try if you don't use very effective method. Psychology, very, very important. Mental part is a key. My recommendation, first work with psychoanalytic, solve problem with the past, especially with relationship with parents, and then go to coach, and he has to help or she has to help to create this object based on real goals and real values. So very important to solve problems with past with psychoanalyst and to create this image of desirable object of yourself in the future. Biotechnology, starting from very old methods such as autochemotherapy. You can take your own blood and inject it into muscles. Very good improving of sport results. Then PRP. You can use it not only for skin, you can use it also for regeneration of vertebrae, for example. And stem cells, especially own stem cells, not embryonal. You can take from your blood, put it to laboratory. They multiply them in multiple amount, put it to the blood, and they becomes like a joker. They can turn into different cells, for example, muscle cells or liver cells or kidney cells. The next block is assistance, very important. So if you have personal doctor who knows you very much, who collected your information, who preceded your information, and developed your personal health improvement program, it's very good option to, and if he knows basis of project management, and he becomes one window where you can apply according to any problem for your health, the performance of this program becomes more and more realistic. Then person takes this function by itself. Person has to work, person need to pay attention to family, and not always they have enough resources or knowledges in order to become such kind of manager. And in such cases, doctors can help. So, I would like to share with you some examples of biohackers. Maybe you didn't thought they are, but they are. For example, David Rockefeller, old school biohacker, 7 transplantation of heart, 7. So he tried to improve quality of his life, the duration of his life, but as we know his genetic, all his fathers and grandfather, they all lived about 100 years. So we can see that from the one hand he helped himself a bit, but from the other hand operations are not so easy. So he didn't help himself a lot with these operations. Elon Musk. Let's compare his health based on those indicators which we just described. After 18 years, his health is better. What do you think? Does he know his genetic? I'm completely sure. What do you think? Does he have personal doctor who helps him track these parameters? I think yes. I'm sure he has his personal diet program, and he used all the available methods to improve his health. Jeff Bezos, the same picture. Compare 18 years. In our nature, we have to become less healthier with age. But these guys, they break this stereotype. They become more and more healthier with year. And 2 things which also connect these people is they also invest into biotechnology, anti-aging, biohacking, and in space, in some reason. Sergey Brin, also, you can see that he became healthier. And two last cases about our own in clinic. Man, 66 years old, after 2 strokes, weight 100 kilos, young wife and young child. He's very motivated. And also he is owner of Outsider Football Club. After 4 months of work, he lost 12 kilos. He had very inflamed ankle. He couldn't drive his car. So after 4 months of work, we, by this complex influence, he lost 12 kilos of weight. He now driving car, and as this parameter correlate with business, his football club get into higher division. For another subject which we can deal with, woman, 36 years old, couldn't get pregnant, and you know, in such condition, it normally goes to artificial things, because in women's organism, everything is very complicated. The examination goes deeper, deeper, and deeper, and as a result, prescription of artificial goes. But general health improvement may become alternative. And after she couldn't get pregnant, after 8 months of work, she got pregnant, she got a healthy girl, and her business was in that, from the very beginning, in a turbulent phase. Now it's, everything is okay. Then, man, 36 years old, top manager of international company, Ironman, you know Ironman, 180 kilometers by cycling, very horrible training. And his fear was not to become fat again. And he was like very, very intensive training. And we saw that his another parameter of internal organs of skeletal muscular system functional, they becomes worse. So he was harming his health. After we worked with him, he decreased length and intensity of his training, and in the same time improved his time of Ironman distance on 45 minutes. It's very good results. So, in this, my part of sharing experience is end, and we can approve or not approve or add something or remove something from this determination of biohacking. Would like somebody add something? Measurable management of health indicators to reach optimal recovery, peak performance, reaching of goals, and self-realization. Colleagues? Yes, please.
You mentioned one thing, right? Saying that clinics are not only for diseased people, it's for healthy people too, to do preventive things. So I would change the first sentence, right? Not optimal recovery, but optimal maintenance itself. Like
so could you please repeat? I don't understand.
I would change the first 2 words, right? Not recovery. I would focus on maintenance.
You see, recovery, it means not recovery from the disease. It means recovery like fulfillment of energy.
Exactly. So you mentioned upfront also that you were focused on preventive care rather than treating. Exactly. Yes. That's the reason why I would encourage you to redefine recovery, but that's the only suggestion I have.
Okay, thank you. Can we vote maybe, no?
Thank you.
Okay.
Presentation.